Osteoarthritis is really a clinical diagnosis, and that means you figure it out based on what the person is telling you, what their symptoms are, which joints are involved, and from an examination of those joints. Sometimes we use x-rays to help confirm the diagnosis, but more likely than not is actually to rule out other things that could be going on, or to stage how severe the arthritis might be, particularly for people who might be candidates for joint replacement if their symptoms are severe enough at that point. Non-pharmacologic interventions are really the mainstay of what we should be doing with osteoarthritis. So although there's a lot of inflammation that can be present in osteoarthritis, and that's certainly something that we need to be thinking about, a lot of osteoarthritis, particularly as we think about the knees and the hips, are based on biomechanics. So that means that looking at someone's strength, someone's alignment of their joints, whether both legs are the same length or not, all of those things are things that can be treated and are amenable to non-pharmacologic types of interventions. So what's really important to be thinking, particularly when you're talking about knees and hips, are referrals to physical therapy so that people's legs can be measured for length. People can be seen if they are malaligned, as is the legs going out like this or legs going together like that, both of which can be altered to a degree with various braces or things to that nature, and whether or not there are some assistive devices that could be used, like a cane, or the proper way to do that. In the hand, there's benefit by referral to an occupational therapist to help with some activities that people may have difficulty doing depending upon which of the joints are involved. The base of the thumb, when that's involved, can be very symptomatic and can give people a lot of functional difficulty because of the fact that that joint is used for almost everything you do in your hand. And so splinting and those sorts of things can be very helpful in that setting.